Effective communication is the backbone of quality healthcare. The insights shared by the students at Butuan Doctors College remind us that every interaction, whether it's understanding a patient's unspoken fears or clearly conveying complex medical information, plays a crucial role in patient care. So, what is it really?
Hello everyone! I am Salmia Samanodin. We are here at Butuan Doctors College to ask students about their insights on the topic Purposive Communication. We are going to task how much they have learned this semester so far and maybe even hear their thoughts on its relevance to their program. Hi guys! Do you mind if I ask you a question?
Sure.
What are your names?
I'm Rafael.
And I'm Lorraine.
I'm Kyla.
My name is Lucia.
My name is Phoebe.
My name is Michelangelo Van Dyke.
My name is Nika M. Carcido.
I'm Beatrix.
I'm Miggy.
So the question is, among all the topics discussed in purposive communication, what topic do you think is relevant to your program?
It would probably be non-verbal communication. As future medical technologists, we will often work with patients who may be unable to express themselves due to anxiousness, fear, or may not have the ability to talk. But by having the skill of charades, which is acting out certain words or phrases, and by the skill of reading body languages, facial expressions, or gestures, we can effectively communicate with the patients. By having the skill of nonverbal communication, we can ensure the best care possible for the patient and build trust with them. And overall, help us become a compassionate and professional healthcare professionals.
Also, good verbal communication is as important as non-verbal communication too. It helps effective patient care and teamwork, assisting and educating patients and addressing their concerns to improve patient outcomes and satisfaction. Good verbal communication promotes collaboration among the team, especially cases where we need to troubleshoot technical issues and casualties that may have happened.
Oral presentation for sure.
What is oral presentation?
An oral presentation is when you talk in front of an audience to share information or explain a topic. It is important to organize your ideas clearly and speak in a way that it can be easily understood by others. Learning about oral presentation is useful, especially in this program, because you'll often need to explain laboratory test results to doctors and patients. Being able to present your information clearly can help others understand complex medical information, which is a key part in working on healthcare. It also helps you build confidence in communicating medical information clearly.
Personally, I liked how we tackled the concept of context, and if we think about it, this topic is relevant in this program. Understanding context allows us to make informed decisions. For example, when analyzing test results, it is not enough to just look at the numbers. We need to consider the patient's medical history, their physical state, and even social and psychological factors. The awareness ensures that we're delivering results that are both accurate and relevant. Knowing how to read and adapt to various contexts is a skill every one of us must develop to practice effective communication and patient-centered care.
As a medtech student, I think we should appreciate the importance of adapting communication styles, considering that we have many different audiences in healthcare. One of this is technical communication, which is essential in discussing advanced medical devices among colleagues that requires precise terminologies. However, when it comes to patient interaction, we must use simpler patient-centered language to clarify complex concepts. There is also interpersonal communication, since I believe that within teams, communicating is crucial. It fosters empathy and active listening, and also enhances collaboration and holistic patient care.
Holistic?
Intrapersonal communication.
Can you elaborate what intrapersonal communication is? How is it different from interpersonal communication?
Intrapersonal communication is the internal dialogue or self-talk that occurs within an individual, involving reflection, thoughts, and feelings about oneself. Compared to interpersonal communication, this is a more of a one person only type of communication.
And how does it benefit us in this field?
I would have to say that it supports critical thinking, decision making, and self reflection. For instance, when a medtech encounters an unexpected result in a patient's blood test, their internal dialogue allows them to methodically review steps, consider potential errors, and decide whether to retest or consult a supervisor. In high pressure situations, such as handling urgent lab results for critically ill patients, intrapersonal communication helps with them staying calm, focused, and accurate. It's good that this is taught to us early on, which gives us more time to improve ourselves. Better than having to figure it out just on a whim.
For me, the most relative topic in purposive communication is intercultural communication. As medtech students, it is a crucial skill for us since we will be working with diverse patients and healthcare workers. This skill is not only about the language but also understanding different customs, values, and ethnicities of the patients and workers. It allows us to have a more smoother communication, and it enables us to have a more compassionate and intrinsic workplace environment.
For me, the topic about the principles of effective communication can be really helpful as an aspiring medical technologist. Effective communication in medical technology ensures precise and clear information sharing. As we get to meet different people, may it be patients or colleagues, we must ensure that we can communicate effectively. Understanding your purpose, audience, topic, and context allows medtechs to convey accurate laboratory results and medical information. And applying these principles into our daily practices promotes reliable professional communication, which benefits both academic and clinical settings.
We must remember also that our ethics and communication, it really centers honesty, confidentiality, and respect, which a good medtech student must have, especially also with sensitive patient information. We must be complete. We must also be accurate with the information that we convey, regardless if it is needed or not. So it is also important to keep this ethical consideration to mind for the sake of organization. And when we commit to these principles, it goes a long way, not only in building trust with patients, but also in strengthening teamwork, which ultimately contributes to better health outcomes.
As future medical technologists, we are not just learning to communicate, we are learning to connect, to empathize, and to ensure that every voice is heard. In a world where healthcare is constantly evolving, let us commit to owning our communication skills, adapting our messages, and embracing the diverse contexts in which we operate. By doing so, we empower ourselves to become not just healthcare providers, but compassionate advocates for our patients. Once again, I am Salmia Samanodin. Thank you for joining as we explore the valuable insights from the students at Butuan Doctors College on the importance of purposive communication in their journey to becoming a medical technologist. Thank you.